Good morning. Good morning and welcome to Columbus Public Health. I'm Health Commissioner Dr. Teresa Long, and I'm joined by my colleague and friend, Franklin County Health Commissioner Susan Tilgner. Thank you for joining us today for this important panel discussion on a new and emerging disease connected to the Zika virus, but now I think we'll be calling it Zika viral infection. But again, this is all about Zika. In our community, the local public health has a long history and a celebrated history of collaboration with our local health system partners. That's okay. We have a long history of great collaboration with our health system partners, from H1N1 to mumps to Ebola and now Zika. We consistently step up to the plate together to support the health of our community, and as Health Commissioner, I am grateful. Here in Central Ohio, we really are a well-oiled machine when it comes to working together to protect health and the safety of our residents. With Zika expanding, we once again are called upon to do what we do best, and that's work together to protect and serve our residents. Greater Columbus, Central Ohio is indeed a special place. The fact that all four of our local health systems are here together speaks volumes about not only their organizations, but the unique spirit of cooperation that we have right here in Central Ohio. This event and our response to Zika is just one more example of the great partnership and commitment that we all share. With that, I'd like to just introduce Susan Tilgner, and we will be on with our presentation and discussion.
Good morning to you all. Welcome to this gathering this morning. We're very glad to have you here. On behalf of Franklin County, I'd like to welcome you as well. But I think my biggest job today is to introduce all of the experts that are here in the room with us today that Dr. Long referred to, and I'm going to get started on that. So first of all, we have a panel with us that you can see up here, and I'm going to start by introducing the panelists. Dr. Miller Sullivan is Medical Director at our health department, Franklin County Public Health. Dr. Gladys Gibbs is the Student Life Director at the Ohio State Student Health Services. Dr. Andrew Thomas is the Chief Medical Officer at OSU Wexner Medical Center. Dr. Bruce Vanderhoff, Chief Medical Officer at OhioHealth. Dr. Dennis Cunningham, Medical Director of Epidemiology at Nationwide Children's Hospital. Dr. Mark Hackman, Vice President of Medical Affairs at Mount Carmel East, and Scott Whittaker, who's a registered sanitarian and environmental health supervisor of the mosquito control program at Columbus Public Health, and his counterpart, Franklin County Public Health, Charlie Broschart, who's also a registered sanitarian, is the environmental health division manager at Franklin County Public Health, and he manages our mosquito control program. We actually work with a vendor that I'll be talking about in a little bit as well. But one thing I want to just make a point about is that in many places across the country, mosquito control kind of went by the wayside. And while this is one of those, the Zika may not be something that is very, the mosquito control may not be a major piece of transmission here in Franklin County and in our area of the country. We have always had a sustained mosquito control program that's ready to ramp up for whatever it is, whether it's a new virus or whether it's some of the ones that we've been looking at over the years, chikungunya, dengue, and those kinds of things. So we have that in place. Okay, I also want to introduce our experts who are seated in the front row or on the side. Dr. Julie Mangino, Medical Director of Clinical Epidemiology at OSU Wexner Medical Center, and Dr. Stephen Thung, Obstetrics and Gynecology Physician at OSU Wexner Medical Center, and then also Dr. Christina Lashinsky. Close enough, okay. In infectious disease also at the OSU Wexner Medical Center. We also have Dr. Tom Harmon, Obstetrics and Gynecology Physician and Vice President of Medical Affairs at OhioHealth Riverside. Dr. Joe Gastaldo, Infectious Disease Specialist at OhioHealth Riverside. Dr. Mark Herbert, Infectious Disease Specialist at Mount Carmel Health System. Dr. Philip Schubert, Medical Director of Maternal Fetal Medicine at Mount Carmel Health System. And finally, Christina Flores, who's the Regional Director for Vector Disease Control International. And Vector Disease Control International works with Franklin County Public Health. They are involved with CDC, and they have done vector control across the globe in terms of mosquito-borne diseases, and we're very pleased to have them as a subject matter expert over the past few years. So with that, we'll get on to the topics that we're here to discuss today. Thank you.
Thanks, Susan. Thanks again. And again,
Teresa,
I'm sorry. Yeah.
I do have to leave in a little bit, so I wanted everyone to know that I will be slipping out, but thank you.
She's meeting with our legislative leaders, so that's a good thing too. So thanks again, Susan, and to our colleagues at Franklin County Public Health. And again, let's hope nothing happens, because we've got an amazing, amazing show of our health systems leadership and our physician leadership in this community. So again, thank you. So what I will be sharing is both a little bit about how we are going to be informing you and informing the public, as well as how we are working together, a bit about Zika, though that really will come after Dr. Gladys Gibbs then speaks about how we are working with our universities and colleges, and Charlie Broschart speaks about mosquito control. It's then the question and answer that is probably the most important part of this whole discussion. So with that, we are very committed to being transparent, and so let's start with the first slide, which is really how are we already working together. So you may know, but may not, that we have been alerting area physicians with health advisories as the CDC guidance is available. That has been going on for the 6 weeks, 7 weeks now that we've been actively engaged. We have been convening our area health systems and the public health agencies so we can communicate with one voice. This is all about being transparent and, of course, speaking with one voice for our physicians and for our residents who may have concerns. We are convening and have convened our area colleges and universities. You will hear a bit more about that. We have been and will continue to facilitate via the public health system the patient specimens that are going to the Centers for Disease Control to be tested. We are also ready to conduct disease investigation of Zika cases. And then, yes, we will be evaluating and planning, and you will hear more about that, our mosquito control efforts for this mosquito season. Thank you. So how we're informing you, and of course, informing you is about informing the public as well. There is a special webpage, you may already know that, it is up and available. We have developed communication and educational materials and education campaign for residents and area physicians. They have been shared with area physicians and our health systems. There is social media that is going on. We will be, if you wonder, we will be confirming, not today, but confirming when there is a first case here in Columbus or Franklin County via press release. And then after the first, we will then continue to list the numbers on the website as we have already been doing about testing. We will launch an educational campaign to eliminate standing water, the major source of mosquito breeding in our community. Again, it's a little early, but get ready, that will likely be coming. I'm pretty sure it will be coming in April. And then today, we are announcing the launch today and tomorrow of our work with Port Columbus. They will be launching with information for travelers. So indeed, I think you can see it right there. You have a sample of that in your packet. This actually consists of course, posters. There are materials that are available for the traveling public, information cards for them. Obviously, right now, spring break is just about to happen. So again, we want all of our travelers to be fully aware of how they can protect themselves on their travels. And of course, the airport is joining us in additional social media as well. So on to the basics. So Zika. Zika is spread mostly by being bitten by an infected Aedes species of mosquito. You will hear more about this. But again, this is what we are all talking about in our concerns connected to mosquitoes. And these mosquitoes are aggressive daytime biters. They can bite at night, but somewhat different than our usual experience. These are aggressive daytime biters. The symptoms that are connected to this viral infection, the common symptoms are a fever, a rash, arthralgia or joint pain, and conjunctivitis. That's red eyes. And indeed, that can occur within, and we would expect it to occur within 2 weeks. Of import, of course, is to know the next bullet, which really is that symptoms are mild, but actually are only appearing in 1 of the 5, or only 20% of those persons who become infected. So why does that mean the next slide is so important? There is no vaccine, there is no medicine to treat Zika. So the best way and the most important is for people to prevent the bite of the mosquito. So indeed, we are very concerned. We want people to understand this association with mosquitoes. And so let me go to why also we're concerned connected to the complications. What we have learned, while it may be a mild illness, there are associated, and again, there may be questions about what we know, but again, right now, we know there is an association with birth defects. This infection during pregnancy has been linked to birth defects, and in particular, we are talking about microcephaly, though there may be others, and again, neurologic complications. And again, this has been known so far to be known as Guillain-Barré syndrome. And again, we'd be happy to chat about that. We've got experts who can share more about that. But ultimately, it is about preventing both the infection and the complications that we're here to share more information. So, travel. So indeed, we know that this virus has actually been around for some period of time, but clearly has gotten much more attention since May of last year, and obviously really over the last 2 months as it has rapidly moved forward. I had counted 31 countries. Actually, you have a list of the countries that now, as of last night at 9 p.m., actually have active local transmission of Zika, and they are in your packets. That number is changing daily. So, or if not daily, it is changing frequently. So that's one of the key messages for you, and obviously for our public, is if they are traveling, if they have concerns and questions, they need to go to the CDC website. Again, these countries right now are particularly in South America, in Central America, and in the Caribbean. But again, you have the complete list as of last night in your packet. So onward with respect to how else can it be transmitted. The sexual transmission of Zika has now been documented from a male partner. It is possible, and in fact, we are learning much more. There was just a World Health Organization Executive Emergency Committee looking more and learning more and sharing more about the sexual transmission with respect to Zika. So again, this is something that we all need to pay attention to, and again, the guidance then becomes particularly important when we're talking about the sequelae, the complications that can occur. So with all that being said, here's some information that, again, is at a high level, but is very important for your audiences and our public to understand. For pregnant women should avoid travel to any area where Zika virus is spreading, where there is local transmission of Zika. If they must travel, so if you must travel to one of these areas, do talk to your physician, your provider first, and then strictly follow the steps to prevent mosquito bites during the trip. I'll speak a little bit more about that. And also to use condoms or to have a partner use condoms every time and correctly, because with anyone who may have traveled to these Zika infected areas. Or, and importantly, they may abstain from sex. For men, and particularly for men who have traveled to the areas where Zika is spreading, if they are sexually active with a woman who is or could become pregnant, they should use a condom every time and correctly, or abstain from sex. So on to how we will be sharing and have been sharing information. So here you have the latest information of those persons who have been tested in Columbus and Franklin County. You also have a copy of this, I believe, in your packets. But indeed, as of yesterday, there are 28 persons who have been tested here in Columbus and Franklin County. All have been negative. People have asked about how, and we are committed, again, to transparency and putting up this information as we get it. We want everyone to understand the only route to being tested is through their physician. So if pregnant women or symptomatic men have questions or believe that they have been exposed, they should contact their physician, and that is the route to being tested. The testing results, just so you know, right now we are absolutely committed to get them back as fast as we can. They're running anywhere from 2 to 4 weeks, though actually the most recent test results have been coming back in approximately 2 weeks. So stay tuned. We hope to continue to see that kind of rapid test result return. When there is a first case here in Columbus or Franklin County, that test result, we will send out a press release. You will be informed of that. And then from then on, we will continue to post the test results and the actual case numbers, just like the State Health Department does, but they will be available on the website. So onward to, again, a key message about preventing mosquito bites. The most important opportunity for those who must travel to where there is local transmission or thinking ahead to our late spring and summer here in central Ohio is for people to avoid or to reduce exposure to mosquitoes, to wear long-sleeved shirts and long pants, to stay in places where there's air conditioning, where there are window screens or door screens that do not have holes, to, again, if people are traveling where there is not air conditioning or good screens, they should sleep under mosquito netting if available. And we really hope that would be available. Every effort should be made to have that available. And to treat their clothing prior to or at the time of travel with permethrin, or to buy permethrin, which is a insect repellent. And let me add it here and I'll say it again, but to use an EPA-registered insect repellent and to follow those guidances about how to use that insect repellent. And yes, indeed, insect repellent, the EPA approved, is approved for pregnant women, for breastfeeding women, and for infants over the age of two months. So the other and stay tuned, again, something that our mosquito control campaign will heavily focus on is, again, about getting rid of or emptying items that hold water around your yard, around any of our neighborhoods and surroundings. Again, treating rain barrels for mosquitoes, checking and repairing those window screens, and again, using the EPA-registered insect repellent. So, as we move on, we want to definitely share information about how we are supporting specific populations. Spring break is right around the corner. And indeed, we have been working with, and actually I'd like to introduce Dr. Gladys Gibbs from Ohio State University's Student Health Center to share with you what they and we all have been doing to, again, be sure that our traveling students, our faculty, and staff on their spring break can be as safe as possible. Dr. Gibbs?
Good morning, everyone. Thank you, Dr. Long. So I'm Dr. Gladys Gibbs. I'm the Director of Student Life, Student Health Services at The Ohio State University. The university considers among its top priorities the health and safety of our campus community. And as many of you know, it's like our spring break starts next week. And we have many students, faculty, and staff who will be traveling both near and afar. We have made an extensive effort to make information about Zika and its sequelae available to our students. We've collaborated very closely with Columbus Public Health, Franklin County Public Health, and other local and regional partners to gather the latest information and disseminate it across the university. We are currently using the material produced by Columbus Public Health, which was based on materials from the Centers for Disease Control, and added our scarlet and gray touch to it to be well received by our campus community. But we want to make sure that we're consistent with our messaging. And since we know that many of our other Columbus and local area college and universities are also nearing their spring break time, we've actually helped to facilitate meetings with those other area colleges and universities to share these resources. This cooperation has been extremely important. As Dr. Long has said, it assures that our messaging is consistent and that we are all speaking with the same voice about the Zika virus. Students who have any concerns about traveling to the Zika area have been prompted to contact us as Student Health Services. We have, however, proactively reached out to students, faculty, and staff who are traveling to Zika-affected areas and engaging them in active conversations to provide them with the latest health information regarding the virus. We've also used every other modality that our students are using, including direct emails, posters, digital signs. We have a dedicated website just for Zika, and we have a big social media campaign to get the word out. Our goal is to provide anyone, but especially the students, faculty, and staff who are considering travel to Zika-affected areas with the information they need to make an informed decision. I'm very grateful, having just moved back from Boston to Columbus, that I live in a community that we have such rich medical resources and where we work together so closely for the good of the public. And so now I'd like to introduce Charlie Broschart, who is a colleague from Franklin County Public Health.
Thank you, Dr. Gibbs. Pleasure to be here today, and what I want to do is we've focused a little bit on the medical side and the educational side. It wouldn't be complete unless we talked about mosquito management, mosquito control. It's part of the big picture of how we control Zika and other emerging vectors. And it also stresses the importance of how it's really important that we have support on the local level to manage these programs and to manage vector control and mosquito management on the local level so we can adapt to things that come into our environment and into our communities. First of all, you've probably seen this slide, and this is the distribution of Aedes mosquitoes in the United States. We have Aedes aegypti, which is the culprit, which we all know at this point in time is the only known mosquito that carries Zika in the Americas. It's an aggressive daytime biter, as Dr. Long talked about. It does have some activity periods at night as well. And right now, this mosquito is not found in Ohio. The Aedes albopictus, the Asian tiger mosquito, this is what we consider a very competent vector for the Zika virus. Again, an aggressive daytime biter, follows the same patterns as most Aedes species. But we do have this in Ohio. We do have it in Franklin County and Columbus. One thing that's been very good about the Aedes, it's adapted very well. It started off as a forest mosquito, and it has done very, very well with being able to adapt to the urban environment. We've provided a tremendous amount of habitat for it. So why are we planning early at this point? And I think with the weather, maybe we need to step it up even quicker if it continues to stay warm. The big thing we need to worry about is that humans are the host or the carrier of the disease, not animals. When we've looked at other viruses that have come and gone throughout Ohio, West Nile virus, Eastern equine, lacrosse, those are all cycled through animals, whether it's birds or mammals. This one, the humans are the carrier, so it's got a little different twist to it. It follows the same pattern of chikungunya and dengue, so we need to be aware of how that operates within the environment. Secondly, we only have one of the mosquitoes that is in Ohio, and that's that Aedes albopictus. These are difficult to trap. We're very good at collecting mosquitoes that carry West Nile virus. In fact, sometimes I think we're too good at it. We collect a ton of these mosquitoes. But these are a problem, and it's not just something that's unique to this area. It's difficult throughout the world in the United States to efficiently trap the Aedes mosquito. So we have had some experience with this last year. We tried some different trapping, and so we're getting better at it, and we're going to continue to increase that. And then the one possibility is if we could have local outbreaks, and that is a real possibility that, again, if someone is infected and they become bitten by an Aedes albopictus, it's possible that at that point it could become a local outbreak. And our approach so far is, the big thing is changing human behavior, and that's probably the hardest thing we have to do. We're talking about educating travelers of that risk. We're talking about prevention measures on a personal level. And then also with the returning traveler, if they're sick, they need to stay inside so that they don't get bitten or exposed to mosquitoes in our area. And educate the homeowners. We've talked about this. Get rid of standing water. It doesn't matter whether it's stagnant, clear, just get rid of all standing water in all those containers. These are excellent container breeder mosquitoes. And it's just really important that we get that across to people, that they do that. And there's so many sources that we have to be aware of, and the homeowners and property owners have to be aware of, and that includes tires and bird baths, gutters and downspouts that aren't working correctly, flower pot saucers, pools and ornamental ponds, and let's not forget rain barrels. And Scott could probably talk a whole hour on rain barrels and the problems we have with breeding in rain barrels. So that's really important. And then the other thing is we want to make sure that we know that daytime biting mosquitoes are reported to us. And that's really important because we want to know where we're having problems so we can go out and take a look We can identify what species out there, if we need to do additional trapping, if we need to do additional control. So that's something we're going to encourage the public to, is if they go outside and they're being exposed to daytime biting mosquitoes, we need to know that. Can we go back one, please? Thanks. Thanks. So our approach so far, integrated mosquito management, or as we also call it, integrated pest management. And that's just a multifaceted approach to controlling pests in the environment. And we do this through a variety of ways, and it's not all pesticides. That's not at all what it's about. It's about education, it's about eliminating breeding sources. It is about surveillance and trapping so we know what the populations are. We also want to do larviciding to control the mosquito before it becomes an adult. And then adulticiding and spraying is also, it's a legitimate way to control mosquitoes. Secondly, we're going to increase trapping. There are new traps that are coming out. BG sentinel traps is something that we experimented with last year, and we're getting more and more experience with that. CDC light traps are another very good tool to attract this vector and to be able to get the population, get an idea of what's going on out in our environments. And then thirdly, we have limited selected and targeted daytime adulticiding. I can't stress that enough. You're not going to see trucks going down the street in the middle of the afternoon. If you do, call us, because I want to know who's doing that. It's not the way that we're going to control this mosquito, is by putting adulticide out during the middle of the daytime. That's not the way it's going to be controlled. It's going to be controlled basically by larviciding and source reduction. And then if we do suspect a human case, that's really important as we go into that, because if there is a human case, we want to make sure that we get out into that area and make sure that we eliminate within about a quarter mile to a half-mile radius of where that person is. And we're going to comb the area, and we're going to look for the 80 species and do some elimination of sources and mosquitoes in those areas so that it's not transmitted. And lastly, respond to those daytime biting complaints. That's such an important part of understanding where we're having problems within the county. And I say this reason for optimism is that, we only have one of the two species of concerns in Ohio, and it's not super abundant. It's not like the Culex mosquito where it's everywhere. We also have the use of air conditioning, which, again, will limit that human exposure to the mosquito. Winters will kill that cycle. It happens with West Nile virus. It stops for a period of time, and that disease transmission will eliminate itself. And we also have mosquito management already in place in both Franklin County and City of Columbus. So we already use integrated pest management, and we're going to go ahead and continue to do that. And what we're going to do is just kind of step it up a little bit and just make sure that we do a little bit more of what we're already doing. It's doing very well. I did want to mention that Susan touched on a little bit that we do use Vector Disease Control International to execute much of our program. We manage it, direct it, and plan it, but they do the execution. And Dr. Dan Markowski, who was supposed to be here today as one of our panel of experts, is actually working in the U.S. Virgin Islands. At least we think he's working. But he's working with CDC, and they're working on developing a management plan for all the U.S. territories within the United States. So he's working with them, and he's a great resource to Franklin County and to Columbus Public Health and this whole community to bring that international perspective to the problems that we may encounter here. But Christina Flores has been able to step in for additional questions. At this point, I just want to hand it over to Scott a little bit and talk a little bit about Columbus Public Health and what our common approach is.
Thank you, Charlie. I just want to take just a very brief moment just to say, I feel very fortunate, to be working with Charlie, and that we do have two strong mosquito management programs here in Central Ohio. Many other areas and jurisdictions in Ohio don't have that luxury, so I feel really good, and it's a real positive thing here that we have that opportunity to work together and share information. And by doing that, sharing information, working together, we'll have a greater effect, really, to serve the public and have a good public service. And so we're really in a good position there. So we'll reflect all the things Charlie said, about what they're doing. We'll reflect that as well to work with the public, to educate them. Our boots will hit the ground, metaphorically speaking, to find stagnant water sources, to eliminate stagnant water sources, and to really work with the public to help them understand, how our program works, explain to them about the mosquitoes, how they spread disease, and how they can do their part. Again, it's been a pleasure to be here and to work with Charlie and the different individuals here. Thanks.
Thank you.
Well, thanks, Charlie, thanks, Scott, and thanks, Dr. Gibbs and Susan. So now this is the part of the conversation where we look forward to welcoming your questions. We'll be so curious. We've got an amazing group of panelists and experts here with us this morning. So what's on your mind? What question do you have for our panel or our experts? Please, and then.
Can you tell us a little bit more about the testing process and who should be tested? I know you mentioned pregnant women and symptomatic men, but should anyone with Zika symptoms be tested, or are there some who can be eliminated from that testing?
As far as testing, any pregnant woman who's symptomatic, and also even a pregnant woman who's not symptomatic and she's within 12 weeks of travel, anybody with any symptoms within 12 weeks of travel needs to be tested.
And does that go through the CDC?
Currently, all of the tests they go through a provider. We've had people say, where can I call to get a test? That's not, it will go through a healthcare provider, a medical provider, and then they will make arrangements through public health, either city or county. And yes, right now, all of the testing is going through our state health department and on to CDC.
I think it's very important that people remember to contact their physician. Go to their obstetrician, their family physician, their primary provider, their pediatrician, because thinking about who should and should not be tested is extremely important. This test is not one that currently is available off the shelf. This is one that has to go through public health resources, and therefore there is some discernment that goes on in determining who should and shouldn't be treated or
tested.
This is
also partly why we're so glad that the health departments of Columbus and Franklin County brought us all together, because the job for the hospital leaders around the table is to make sure that our physicians, nurse practitioners, people that interact with patients are armed with the knowledge of what to do, so that we're all speaking with one voice.
We sent that message out to all of our physicians across the community, so they all have that same knowledge.
Great, thank you. Now, can you guys hear me? If I step away from that, great. And actually, I would ask if you would come to the microphone and ask your question, because then we can record it as well. So we have a next question.
Hello. Why are there mosquitoes biting right now, and have you ever seen them this early in the year?
Well, I don't know if there's mosquitoes biting right now. Oh, she's got some on her ankles, I see. Then she brought them in. I didn't do that. Well, when we get this emerge, what happens sometimes in the early spring when we get a spell of warm weather, we do have mosquitoes that will winter over in catch basins in some areas where it's warm enough for them they go a little dormant and then they'll kind of spring back to life as soon as that is. So these were adults that probably wintered over. These are probably not ones that have hatched at this point in time. Weather conditions haven't been quite warm enough. So that's a possibility that we do get that. We'll get a little bit of mosquito activity this early. And we've had some springs that start very, very early.
Other questions? You are kidding me. We have lots of questions.
I'll ask a question.
Please.
Is there any danger in making too much of Zika? I mean, can we contribute to any level of panic or something that we don't want to?
Question?
Well, I'm actually glad you asked that, because I think that we absolutely could. There is much that we do know about this, and there's still information that we don't know. And I think it's very important as we're talking about Zika that we keep our messaging straightforward and keep it limited to what we do know. And there's some very important facts that we've shared here today that I think should be the focus. We're fortunate to live in a geography where thus far we've not seen mosquito-borne transmission of this. So this is, for us in Central Ohio, really a question about where we travel. And if we make the decision to travel, and then how we conduct ourselves before and after we travel. And that should be somewhat reassuring to us for now. The other thing that I think is a point that should reassure this community is this gathering of the healthcare community to keep an eye on the evolving understanding of this disease, how it's transmitted, and whether or not we need to have additional concerns or cautions in the community.
I agree with Bruce 100%. I think it's important to state that when mosquito-borne illnesses have been present in most, if not all, of these countries for generations. This is just a new virus layered on top. So the precautions that we're asking people to take with either mosquito netting or sleeping in a space with screens, using mosquito repellent products, those have been in place for other illnesses for years, for travelers to these parts of the world. What we're realizing as a community is spring break's around the corner for multiple universities, colleges, and local schools. And now's the time to really get the message out to reassure people who needs to be concerned, who doesn't need to be concerned, and what they need to do, so that we don't have panic and people being overly concerned. At the same time, if we can prevent one case of a child born with a Zika-related illness in this community, or an individual getting ill, that's well worth all of our time in doing this and all of your time being here today.
Thanks. Yes, please.
Hi, so in relation to college students going on break very soon, especially Ohio State students, most college students that I know at least would frequent a beach for vacation at this time. Do this species of mosquito, do they grow well or thrive well at the beach? Or is that like maybe not a best climate for them?
So I'll let someone speak. Obviously, it has to do with geography. Oh, I'm sorry, Charlie.
I tried to hide. Actually, I'm gonna punt a little bit. Christina, I think, has a good amount of experience with dealing with mosquito control in Key West and areas like that where they do work.
Christina, do you want to come and speak? Christina Flores.
If you can see me over this. Actually, we are working with the Navy in Key West right now, and Key West is south, great weather. The only great thing about working with the Navy is their properties are well maintained, but we're working with local entomologists around, we're working with Navy entomologists around that have been to other regions, and they are finding Aedes aegypti within Key West in cemeteries. Anywhere you go, it just depends on the environment. If there's trash, buckets, everything that Charlie expressed earlier about standing water. So the warmer you are, the more likely you'll see this mosquito. Because they don't like the winter, that's why we don't have any Aedes aegypti up here. But we do have Aedes albopictus. So it just depends where you're going. So if you're traveling down south, the Caribbean, US Virgin Islands, just be aware they do have Zika, they do have Aedes aegypti that are transmitting the virus.
And I would add, I don't think anybody, student or others, is 24/7 on the beach. Maybe they are, but they are going places. Hopefully they'll even sleep a little bit. So again, that's why both, and I know it sounds kind of crazy, but again, these long sleeves, long pants, use of insect repellent, and then when you are able to be indoors, to be sure that there are screens that are working screens, air conditioning, or sleeping nets. Again, it is about avoidance of the mosquito, because in not every country in Central, South America or the Caribbean, but honestly, it's many, many of them, as you can see from your list. And I think some of us wonder, how long will it take for it to be in more?
For students traveling, put your sunscreen on first.
Yes.
And then an EPA-approved mosquito repellent over the sunscreen.
Right. Exactly. Thanks, Joe. Dr. Castaldo. Other questions? These are good. Oh, come on. You're waiting. You're waiting. They're waiting to come and grab each of you. I don't want to close it down until I'm sure everybody's had a chance. Yes? Okay. Great. And again, chief medical officers, thank you all so much. Infectious disease experts, obstetrician, gynecologists, you guys are all amazing. So again, thank you so much for being here. Thank you all for helping us to inform the public. We really appreciate it. Okay, thanks.